In our kidneys, there are around 1 to 1.5 million small filters called nephrons. These filters filter the blood and produce urine. Now the question arises, if you are drinking 2 to 3 liters of water daily, meaning you are putting that much water into your body, then the same amount should also come out in the form of urine. Was this the only job of the kidneys? You will be surprised to know that kidneys recycle 180 liters of fluid daily. The kidneys' work continues non-stop. They recycle proteins, nutrients, hormones, and 99% of water in your body. The filters in the kidneys, i.e. nephrons, contain sensors that help keep your body hydrated. That means they retain as much water as your body needs and eliminate the rest. They balance blood pressure, convert vitamin D into its active form, and remove toxins and drugs from the body. This means any toxic substance present in the body is excreted. I believe that if everyone knew how significant a role these small filters play in the body, no one could even think of consuming anything harmful to these filters. As a person ages, the number of nephrons in the body decreases. In kidney failure, the number of nephrons drops to less than half, and they lose their filtering ability. Diabetic nephropathy involves sugar reacting with proteins and protein structures in these nephrons. In medical terms, this is called glycation, which causes the unavailability of essential proteins in the body. The body needs these proteins, but the excessive sugar engages them, forming bonds and rendering these proteins unavailable for normal body function. This reaction produces advanced glycation end products, which damage and disable these nephrons. The nephrons lose their structure, leading to renal failure. Due to renal failure, these proteins, which should remain in the body, can no longer be recycled and start exiting the body through urine. The presence of proteins in urine is an indicator used to assess kidney function and filtration rate. Doctors diagnose renal damage based on this indicator. Edema occurs as the body begins to retain water due to protein loss, leading to puffiness or swelling. This can happen in multiple areas of the body simultaneously, and the entire body can fill with water. These symptoms take approximately 10 years to appear, but one sign that manifests much earlier is nocturia, waking up frequently at night to urinate. If you regularly wake up at night to urinate and cannot maintain urine control throughout the night, it indicates that your kidneys are not functioning normally. The same problem occurs in patients with diabetes. There is a similarity in both cases. Both take about 10 years to show symptoms. Kidney problems and diabetes often go hand in hand. Diabetes damages 4 types of body tissues: kidneys, which we're discussing, eyes, the nervous system, and blood vessels. If you only manage nocturia, kidneys and diabetes can be managed together. Nocturia can easily be treated if you balance your blood sugar levels and reduce sugar intake in your body. We need to know about the hidden sugars in our daily foods, like carbohydrates, refined flour, pasta, cereals, samosas, pakoras, and jalebis. These are mountains of sugar, meaning they are high in carbohydrates, which convert to sugar in the body. Our Diabetic Association talks about managing diabetes, saying if blood sugar rises, take insulin, metformin, or diuretics for fluid retention, statins for high cholesterol, and medicines for high blood pressure. The problem is that by only managing high blood sugar, it moves from one place to another. It leaves the blood, damages the endothelium, and causes organ failure. It goes to the liver, where it converts into fat. You are merely shifting it from one place to another. Instead, you need to control sugar intake in your diet. Follow a ketogenic diet plan, practice intermittent fasting, and shift your body from running on sugar to ketone bodies. You need to fast or practice intermittent fasting. For instance, the intermittent fasting I follow involves fasting for 16 hours a day and eating within an 8-hour window. Include salads in your diet, as they contain phytonutrients. Phytonutrients provide nephroprotection, protect your kidneys from high blood glucose, safeguard nephrons from oxidation, and maintain normal kidney function. I have observed that when 2 diabetic patients were compared and one was given phytonutrients, i.e. advised to eat salads, this patient experienced fewer complications despite having high blood sugar. The phytonutrients in salads possess antioxidant properties that neutralize the bad effects of high blood glucose. I am addressing those at the initial stage. Definitely, if you are suffering from end-stage kidney disease, You cannot consume salads because of the high amounts of potassium, calcium, and other nutrients. The next remedy is a 300 milligrams benfotiamine supplement. You can take 1 capsule daily. It is a type of vitamin B1 supplement, fat-soluble, and has amazing health benefits, especially in reducing diabetic complications. It reduces glycation effects, oxidative stress, and protects cells. It helps manage diabetic retinopathy, which involves retinal damage due to diabetes and vision impairment. The next remedy is healthy turmeric. Turmeric contains an excellent phytonutrient called curcumin, which is extremely potent. Again, it protects against diabetic nephropathy and retinopathy, possesses antioxidant properties, and reduces sugar-related complications. Thank you for visiting the channel. Take care, and I will meet you in the next video. Allah Hafiz. This translation follows the original